no, there's nothing. You can call the suicide hotline. I'm like, but I'm not suicidal. I'm just having like consistent panic attacks.
Nicole Shanker has been self-isolating in this downtown Vancouver hotel since she tested positive for COVID-19 on February 21st. When she got the call that she had tested positive, her mental well-being began to spiral.
And I started bawling my eyes out.
Shanker is a social worker who moved to Vancouver from Baltimore in August. A contact tracer told her she was exposed to a co-worker. Since her apartment lease was expiring quicker than her isolation period, a colleague from the States helped her find a hotel. She says she wasn't able to get the mental health support she needed from the contact tracers that called her.
At that point, like I knew I had tested positive. I was on like my 5th panic attack of the day, like so scared. Because when you're coming from the States, it's like the news tells you, if you get COVID, you're going to die. So I'm like panicking. My family's in the States. They're panicking. I was like, I don't know what to do. I need mental health services right now. And they're like, there's nothing. There's nothing for us. We're so sorry. I know people who were out for weeks. I know people who died from it. Like, you just don't know. And that's absolutely terrifying.
Clinical counselor Dr. Natasha Ghosh says the response someone might have to a COVID diagnosis is rooted in the way humans developed.
You know, when we think about the physiological response to something stressful, right? Because that's what this is. Our fight or flight system activates. So this system originally developed as, you know, from an evolutionary perspective, run away from your saber-toothed tiger. But COVID-19 is the equivalent of that right now. So we're going to have the same response as we would to a physical danger as we are to having this someone telling us we have that diagnosis.
Then there's the added stigma of testing positive for COVID. You're afraid of getting it and the judgment you might face if you're infected.
So I think that stigma comes from that place of fear and the stories that we do see on the media all the time. You know, we have this breaking news and our body is like, and it's reacting as if it's something new. But the breaking news is something that broke 20 minutes ago. But every single time we're having the same reaction to it.
The Ministry of Mental Health and Addiction says the province has invested $25 million since the beginning of the pandemic to expand online mental health services, low barrier counseling, and more online tools to help people assess their own mental health. They couldn't offer resources specifically for those who test positive for COVID-19 before broadcast.
But I think it'd be really amazing to get social workers on the team of contact tracers to just be on call, to be there because they know what to do.
In Vancouver, Kier Junos, City News.